Second messengers. This is just a quick introduction into second messengers, and the three second messengers we're going to be focusing on are cyclic AMP, which is a classic second messenger, and of course the other two are cytosolic free calcium, which activates signaling pathways that involve calcium binding proteins, and then we're going to talk about phospholipid metabolites. Okay, we're looking at more detail about signaling and second messengers. So it's just a very quick overview from the reading and lecture. So let's look up at the top. We can see cytokine growth factor receptors. These are phospholipid metabolites. Then we see the G protein coupled receptor. We're talking about CAMP, cyclic AMP. And then on the right side, ion channels. And we're going to talk a little bit about free calcium and what happens when this is introduced. So on the left, the cytokine growth factor receptor. What's happening here is that the tyrosine receptor is stimulated by the cytokines, and then there is an activation of the phospholipase, and there is a lipid signaling molecule. And what's happening is this is actually going to result in the releasing of calcium, or calcium mobilization. And you can see the endoplasmic reticulum pointed out there. We should realize that in addition to being a site where you are glycosylating proteins for protein synthesis, this also plays an important role for calcium storage. And think about the muscles of the in the muscles, the sarcoplasmic reticulum is a calcium storehouse, and muscles are stimulated. When muscles are stimulated, they release calcium. Or you need calcium to release muscles. I'm going to get confused here. Anyway, moving on. Let's look at G protein coupled receptors. So we can notice this cascade and how this, when this is stimulated, the heterotrimetric G proteins fall apart and they're stimulated, and then the regulation of adenocyclase takes place, and there is a change in cyclic AMP levels, and this plays an important role in controlling glucose levels. And let's look at the protein kinase A. This is another signaling molecule, and this will phosphorylate other downstream targets, activating them as part of a signaling cascade. So let's look at the free calcium. So this is directly importing calcium through a channel into the cell, and this can activate phospholipase A directly, and also you can see that it is then activating prostaglandins, and in this case it's moving towards protein kinase activation. So all of these processes are seen in the cell, but they just work in different ways, so we should know the differences between phospholipid metabolites, how they work on the receptors, how do the G protein coupled receptors work with CAMP, and how does calcium go through the ion channels. So these are important for us to know. And also we should know that the smooth ER in cells is involved in lipid synthesis and lipoprotein processing events. Alright, I wanted to talk a bit about calcium in the muscle because I got confused about that. So I'm just reading here. It says that the action potential opens gates in the muscle's calcium store, which is the sarcoplasmic reticulum. Calcium ions flow into the cytoplasm, which is where the actin and myosin filaments are. Calcium ions then bind to troponin and tropomyosin molecules located in the grooves of the actin filaments. Normally the rod-like tropomyosin molecule covers the sites on actin where myosin can form cross bridges. Then upon binding calcium ions, troponin changes shape and slides tropomyosin out of the groove, exposing the actin-myosin binding sites. So myosin interacts with the actin by cycling cross bridges as described previously. The muscle thereby creates force and shortens. After the action potential has passed, the calcium gates close, and calcium pumps located on the sarcoplasmic reticulum remove calcium from the cytoplasm. Well, there's more to this, but I just wanted to get some more knowledge about this. This is very important in muscle function. As the calcium gets pumped back into the sarcoplasmic reticulum, calcium ions come off the troponin. Okay, I'm now starting to remember this again. Thanks very much. Let's move on to the next slide.